Thank you, everyone, for coming. Noel, you want to stand up here with us? Come on. Don't be shy. Don't be shy. This is the founder. You got to get his picture.
Yeah.
Okay? We didn't set up our office didn't set up the logistics, but we're so thrilled. We're so thrilled to be here and to be here with the Graham family. At least 3 generations of which I'm aware.
We go
back many years, and all of the craftsmen and women who are in the room, you have no idea how much I respect your work in tooling and in bringing this vehicle and many others to the road. I come from a family, I don't know if anybody here is ASE certified, but a family that appreciates those who tool and propel our nation forward on the ground, in the air, on sea. So you really help build a reputation for excellence here. So everyone that is a part of this operation and the dedication of this particular unit today, which we will tell you more about in a second, you should be very, very proud. And you've made Tesco a leader, not just regionally, but nationally. I was at an event over on the lake a few months ago, really, in which the National Hospital Association and many other people recognized Tesco for their leader, not for being a leader, not just in transportation, but in healthcare. And I know in education and all of the work that you do to move people around our country and our region, you really are a major leader in the transportation business in our region. So to Bud, the current president, and he's right back here, standing behind me. Don't stand alongside. They're real good. And to your father and to the whole team, thank you for hosting us today and for winning this contract. All right, because this was federally competed. There was over $500,000 that we were able to mark in our bills that would go to healthcare, but that didn't mean that Tesco would receive the dollars. And I want to thank the president of the University of Toledo, Dr. Postel, who is with us today and was just promoted. He's going down to a bigger medical school in Cincinnati, but literally, he saved our medical university here. If he...
Very nice, thank you.
And I'll tell you, it wasn't easy in a state of Ohio that forgets we're not in Michigan or Canada, but we're actually in Ohio. So I want to thank him for everything that he has done and will continue to do. And this particular mobile addition to the healthcare that we are able to offer in our region. When I was younger, there were television programs. People watched them. I guess everybody watches apps now. But there used to be one where one of the theme songs was "Rollin', rollin', rollin', keep those doggies rolling." Well, what we're talking about here is rolling, 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 but rolling out healthcare. And in a way that we haven't seen in this region. And I was thinking when I was a little girl in the neighborhood I lived in, which was a township, there weren't any hospitals there. There weren't any urgent care centers there. We would walk 2.5 blocks to Dr. Bayer. And Dr. Bayer, I still remember the alcohol when you walked in the office, not the kind you drink, but you clean your instruments. I could still remember kind of scary going in there, and things happened. You got vaccination shots, and you heard babies crying, and there are all kinds of things going on in there. But as I go around our community today, medicine is arranged in a very different way. And there are big buildings you have to go into. I have people from Ohio who've come up to me who live in the Appalachian area south of Akron, who don't want to go into Cleveland, to the Cleveland Clinic. They're afraid to go into Cleveland because the roads are so complicated. And so I look upon the region that I represent in the northern quarter of Ohio, many towns, there's nobody there. Communities that I've represented, it's the veterinarians that deliver babies. And there's a shortage of doctors. We have one hospital in the West, rural hospital, in big trouble right now. Not because of anything it did, but because of what providers did to it. And so we have a lot of people that come home from the service and they rotate out into the countryside. And there's really no health care of a major consequence. Yes, there are some smaller hospitals and so forth, But we are one of the most underserved regions of the United States of America, and definitely the state of Ohio. All you have to do is, anybody been in Columbus, raise your hand. Did you ever see the size of the Ohio State University Medical School? Then ask yourself the question, why do we have to fight so hard for pennies up here? So as Ohioans, I'm just informing you, for every person that is involved in this fit, you will save lives. You will save lives. Now, what's it going to do? Well, it's going to roll around the region, and the doctors and medical personnel on it are going to save lives. They're going to do that by going to hard-to-reach people, and that includes even in the city of Toledo, if you can believe that. And if you want to follow me in a month, you'll meet thousands of people. And you can do blood pressure screenings, for example. But on board will be residents that are learning to be doctors. There will be medical students, and there will be physicians and probably physician assistants and nurses, depending on the way that the university deems appropriate. Now, Mr. Rick Swain is here. And where is he? Is he out? Rick, you got to come up here. Come on. This guy he's always in the background. Okay. But he's important because he runs the hospital.
Yes, he does.
University of Toledo Medical Center, and he's got his hands full. And we appreciate your being here today. We hope that this will introduce a vast region to the university, and people will enroll because they realize you're there. And they might not understand the work that they can do inside the hospital and in many of the classrooms, improving health outcomes. And what kinds of things will you find? Number one, you'll find sore throats when you go around. You're going to find people with allergies, blood pressure. I got one of my neighbors I want to bring. When you come to my neighborhood, I know just the guy I'm going to bring in, if I can catch him and get him in there. Nutrition advice, early identification of cancer, markers for cancer. And for women, we have one of the worst infant mortality indexes in the entire country and state. So we hope being referred to proper care in order to bring a child to life. And finally, coronary artery disease. There are early warning signs where we can tell things by just coming on a bus like this. So there are many healthcare providers who are here. We want to thank you. I've been given orders. I have to do this just in the proper way. So as we celebrate the moment when we will turn the keys from the company over to the University of Toledo, let me introduce just a fine doctor to you, a radiologist who happens to be the president of the University of Toledo and has taken a special interest in saving its medical center and all the research that it does, not just for our region, but for the world. So Dr. Greg Postel, thank you for being with us today.
Thank you.
My pleasure.
Well, good afternoon. We are so happy to be here with our friends and supporters this afternoon to celebrate a really unusual and special event. So I think it's well known that Congresswoman Kaptur has been a great friend for many, many years to the University of Toledo. So much of the funded research in which we engage is possible because of opportunities that she helped create. It would then also be no surprise what a great friend she's been to UTMC. She's been a supporter of our hospital for many, many years, long before I came to Toledo, and we were always grateful for her assistance as we did the things that we have needed to do to strengthen the hospital. So I remember it was probably a year ago, Diane Miller, who's here and who heads our government relations, came to me and talked about, early conversations with Congresswoman Kaptur about the possibility for funding for a mobile screening unit for our hospital. And so it was a long time ago, but boy, was it worth the wait. Our friends here at Tesco have done just an amazing job building the mobile van behind us. The folks here along the VA van to the side who helped make this, congratulations to all of you. It's beautiful. Just a very, very nice looking and very functional van that'll be so useful for us. So as Congresswoman Kaptur mentioned, one of the things that UTMC is well known for is our mission to help provide more access to care and to provide high quality care to underserved populations, whether they're right in the city or whether they're farther afield. And that's what this van is going to allow us to do. We'll be screening for blood pressure, for elevated blood glucose, for elevated cholesterol, those types of conditions. And those are conditions that don't have symptoms. And so that's what's scary. The patients have those abnormalities and don't know it, but they can lead to real serious problems. Cardiovascular disease is still the #1 killer in the U.S. And in this country, almost half of people have high blood pressure. And so we can easily screen for those conditions on this van and help the patients understand that they need medical attention. And then we'll probably need to come to a facility to receive care to make sure that doesn't become a problem. And that is just right in the sweet spot of the mission for the University of Toledo Medical Center. So the other thing I'll say is that the van is built in such a way that the services here can be expanded. And so it's our plan to have communications with our communities to find out what they need, because it's really important to learn from communities what they need before you decide what to provide, right? We want to make sure that we provide exactly what is needed. The other person here today that I want to thank is President Greg Lana from Anthem, who's right in front of Diane. Thank you very much. Anthem is providing additional funding that will help us with supplies and will help us with the branding of our vehicle. And so we appreciate our relationship with Anthem and your support of this project. So what a great day, what a great opportunity for the citizens of Toledo, and what a nice chance for UTMC to continue to fulfill its mission. So our next speaker, I'd be happy to introduce, just recently got to know Bud Graham, who's the president of Tesco, and you should be very proud of your organization. There's Bud. All right.
Completely.
You're next. You're next. Go ahead.
Thank you, Congresswoman Kaptur. Also, appreciate the kind words. Good afternoon, everyone. I'm Bud Graham, president of Tesco, and I'd like to welcome you all to the ribbon cutting ceremony today. Congresswoman Kaptur, it's always a pleasure having you come visit us, and we truly appreciate you coming to Tesco today. We also thank you for serving Ohio's 9th Congressional District for over 4 decades. We also appreciate and thank you for improving access to health care and all the many accomplishments that you have achieved over all that time. We also, and for your continued support of projects like this, like the University of Toledo medical vehicle here, mobile medical health clinic. Dr. Postel, again, thank you for entrusting in us and our team. For all the confidence that you had in us to be able to build what was necessary for you to be able to perform the services you're looking to do. We are Tesco's a 3rd generation family business. We've been providing quality vehicles for our customers throughout the country for over 55 years. The founder of our company, the founder and CEO, Noel Graham, of course, Congresswoman Kaptur introduced him earlier, but this is my father, Noel Graham. I want to take a minute to be able to give him accolades. Without his vision early on, way back in the day, we wouldn't be where we are today. So we've been very fortunate to be able to, take his early vision and be able to take it to the next level. Also, we're very thankful for the over 100 plus dedicated employees that we have here at Tesco, who are committed to supporting our customers each and every day. I mean, without them, we don't have a company. So it's fantastic that we do have all these quality employees that are very talented with what they do. Tesco Specialty Vehicles was instrumental in providing much needed mobile clinics in a timely manner during the pandemic. We're proud that our vehicles are being utilized to provide mobile healthcare services in communities throughout the country. My son Brent and his TSV team do incredible work with our mobile health clinics. We appreciate support for these types of healthcare services from Congresswoman Kaptur in our partnership with the University of Toledo for their new mobile medical unit. Thank you so much. And thank you.
Is it the last speaker?
I am. You are. I think you follow.
I wanted to tell you two stories. You got about 5 more minutes where you can stand? You okay? All right. So you say, well, what does this have to do? For every person here who has even touches healthcare in any way, think about this. Years ago, long before Dr. Postel got here, there was another president of the University of Toledo, and he lived way out in the boonies. And we were talking one time, and I said, you know, doctor, I said, I represent more hogs than people. And I said, a lot of those businesses are going out of business. And I said, I don't know what to do. I said, is there any connection between animals and medicine? And he looked at me, he says, you know what? He said, I grew up as a farm boy. I ride from where I live back to the university every day, and I think. And he says, you know, you're asking me about hogs. And so we started working with farmers in Lucas County and Ottawa County, the Pfeiffer family. I don't know if anybody's close to the Pfeiffer family over in Ottawa County. And they developed sterile hogs. The valves from those hogs are still transplanted in human beings till today. Now, I understand there's some kind of new technology coming out. I don't know if that'll ever be replaced, but we felt we had changed the world from inside this particular county. Recently in the news, there was a story about the first person in America to receive a kidney transplant. And I know the University of Toledo has a specialty. I've been in those wards where you do the kidney transplants. And I'm thinking, well, I don't know how that transplant went. It was quite a heroic American that had that done. I think it was in New York. I might be wrong. But I thought, hogs again. And we got a whole lot of them here in the Western Basin. And so never discount the connection between agriculture and medicine. And as you're riding through the countryside and you're thinking about that, those of you who live in Oregon or places around the more urbanized part of our community, let your mind wander to agriculture and medicine and other things you will hear on the bus that we could turn into products. We have companies in this region that have invented special kinds of stockings in order to keep the blood in your legs in a certain place. All right, Medtronics for pacemakers, if I'm using the proper word, for the heart, for tracking what's happening in the heart. And I was in a lab in Toledo one time. One of the things we don't do, we don't innovate. We don't patent our innovations. So I was in one lab, and the first lab I was ever in where nothing rolled on the floor. And this woman who owned the lab had this decanter that was shaped like a trapezoid. So when she put the sample down, it didn't roll off the table. I said, where did you buy that? She goes, buy it? I invented it. And so the University of Toledo has a platform for innovation. And if you have a good idea and you're afraid to patent it or you're afraid to take it to market, they have the ability to do that. And you might have such ideas in the vehicles you manufacture, and you're just taking it for granted that you manufacture it here, but it might have an opportunity to be transitioned into the marketplace. So just every single person here can think of innovation just based on what you see every day and experience every day, and do not think it's unimportant. And I'll end with this story. Dr. Postel wasn't president of the University of Toledo when this happened, and Mr. Swain was not head of the hospital. So I went to a meeting of nurses, and these are really intelligent nurses. They were moving up the academic chain, and they were complaining about the cost of tuition. And I said, yeah, I hear what you're saying, but let me ask you something. You get in all these operating rooms, you're spending your life in medicine. What do you know that nobody else knows? What product do you think could be brought to market that doesn't exist? And one of the nurses said, oh, you mean like the surgical glove with the long finger? Now, you think I knew anything about that? I said, I have no idea what you're talking about. And she said, well, Congresswoman, every year, Eli Lilly comes to the university and does a lunch. And they ask us the same question as you do. What do we see? I said, so you give your intellectual property away? We could be creating companies here based on what each of you knows, but you don't think that way about yourself. So I'm just encouraging you to be like Noel, to be like his son. Think about inventing for the future from the field that you know best. Never underestimate it. I remember once Ronald Reagan stood up with a beer cup or something, and he goes, look at the person that invented the thing on the outside so your hand doesn't get cold, right? I thought it was interesting. He picked that invention of all the inventions he could find. But the point is, what you do matters. Who here is a mechanic? Anybody here a mechanic? Go inside, put your head under the engine. Raise your hand. There's got to be one. Okay. You know so much. You know so much. And we, as a propulsion community, need your skills to be put with about 200 other people like yourself to invent a Great Lakes car. New car. And that would beat anything in the marketplace. We just haven't put the people together. So I just wanted to thank you all for coming. I see there are some people here from the university. Diane Miller is here. Thank you, Diane. She has her hands full. And Margie Treband, I know they had something to do with setting this up. Thank you both very much. Sue Rowe from our own staff, I thank her for making sure I got to the right place at the right time and for helping to set all this up. And congratulations to all of you. And I think you should lead us to the next step.
I don't know how to.
Somebody count. 1, 2, 3.
Yep, the one with the scissors, I like to come and cut.
Cut.
We don't want that in the operating room.
That was really good. As always. Love seeing you. Yeah, put it down.